Hello, all. Just like the case of all psychiatric tests, I would like to speak about some of the manipulations of RITA tests and how we can prevent. First, significance of diagnostic tests, risks of manipulation, how manipulation performed in diagnostic tests, and which strategies we have so as to prevent manipulation. First of all, diagnostic tests and their significance. As we all know, these tests are for measuring and assessing something. We're not trying to put diagnosis, just collect some data to help us to have a diagnosis. So they are tools supporting the diagnosis. And therefore, I will speak about what risks of manipulation we have for these tests. Manipulation, there are certain psychological factors that may increase the risk of manipulation, especially if we can very well identify these manipulations, we can prevent them. In the treatment plan in particular, as a clinician, this is something that helps us to prevent it. What could be the risks of manipulation? In general, social acceptance, the need for social acceptance, personal gain, and trying to reach a conclusion. For social acceptance, as we always mentioned, acceptance, approval, for recognition, for approval, from time to time, involuntarily or voluntarily, we may manipulate us and others. As I'm telling you, it's not conscious. It could be conscious or unconscious in the way we do it, but this is mainly due to the social acceptance desire that we have. Also, while performing the test, it is the same thing. It could be personal gain or secondary gains. I mean, we can call it both. I mean, for our personal interests or for some gains, from time to time, it could be some financial gain or some emotional benefit. We may mislead people and give misleading answers to the questionnaires. And the desire to attain a goal. For example, as you all know, the clients, for example, who are willing for a prescription are trying to fake symptoms or some fake well-being again. I mean, the goal in here is actually for a data manipulate. I mean, it could be both for the parents, the friends, and even for the specialists. How about the tests? How we do the manipulation during the tests in clinical observation, for example, or in the field? We can observe these manipulations, but how about the tests? Three main things. The first thing is they change the answers, add some misleading information, and the third thing is at the same time to actually cheat from the other test resources. By changing the response, as I told you, it is either consciously or unconsciously. This is a purposeful, intentional, and conscious changing the answers. In MMPI, for example, from time to time, depending on the result that they would like to get, in saying correct, wrong, that's how we do it. Because we would like to do something. Maybe you're looking for a prescription or being exempt from something or just to show something to the parents, prove something to the parent. And sometimes we may hide things. I mean, not overestimate, but underestimate. Or from time to time, misleading information can be added. What do I mean by this? Let's assume, for example, the severity of a symptom is X. Just to show it 2X, add additional information. Let me give you an example. Adolescents, for example, mainly. From time to time, yes, they have some clinical symptoms as well, but let's assume borderline personality disorder. Rather than this, some symptoms that may look like bipolar that they highlight. It's the secondary gain that they have. I mean, for example, so much feedback about sleep, movement, or shopping, for example. If they do so much shopping, I'm bipolar, of course I do shop a lot, these types of things. I mean, a diagnosis that is not existing, so exaggerating it. Or just to legalize or legitimize what they are doing. It could be misleading, so the clinicians should make a good observation. But during the tests in particular, we may not observe it. Again, from the very same, in MMPI, for example, 566 questions, all answered. It doesn't matter. Just the correct and the wrong data that they provide us. Uh, for example, we cannot open an additional thing. So it's quite likely that they manipulate the test. And at the same time, copying from the other resources. In Rorschach, for example, we observe it a lot. Although it looks like a personalized test, first they check the Google and then try to understand what the result would be if I circle which ones, or just like actual cheating. Like, for example, seeing flowers everywhere would be a nice feedback. Fear of dark is not a good thing, and so on. So they're cheating. And so this is also something that you cannot stop and you cannot prevent. I mean, intentional cheating. So it's okay. How about during the tests? How we can prevent the manipulations? Well, three main things: psychoeducation, ethical rules, and safety protocols. Psychoeducation, psychotraining is something that we discuss with the client. I mean, providing feedback that it may be not good. Of course, to the extent of compliance, I just have to make a statement. In codes of ethics, again, to the client, how important it is. It could be the psychiatrist or the psychologist, how important it is to be ethical, reminding this also actually restores the confidence to the clinician as well, the test results and all. These are all very valuable steps. And at the same time, there are certain safety protocols embedded in the tests so as to prevent manipulation, like the duration of the test, some controversy in answers, control questions, for example. For example, again, in MMPI and SCIT, or subscales. In MMPI, for example, on its own, just 560 questions that they answer, but it is a lie, like about being in defensive personality disorder or about frequency and rare. For example, we understand that they did not take the test seriously, or a question that actually has the same meaning, a couple of, for example, steps more wrong and then correct. So these are the, I mean, probably some could be due to negligence, but sometimes people do it intentionally. Even from time to time, for example, they check and then go up. I have these very similar questions, and it's difficult to do it in the adolescents. In SCIT, it is again interview format. So if it is yes, you continue. If no, do not continue. In MMPI, it's much more difficult to get it. How about RITA to prevent manipulation? What do we do? Four domains. Social appraisal, subscale, and completion of the test, and get information from the client whether doing any cheating in the test. This is actually a test already performed. It's again a fake invented one. In controversial answers, as you can see, at least in one domain, there are controversial answers. It gives you a warning. In the other three, for example, there's actually no manipulation at all. This is actually a screen from Rita. Social appraisal, I mean, lying, accepting error, or again, tolerating different opinions. Never, sometimes, very rare, almost none, or no comment. So, three questions. By asking three questions about social, for example, appraisal, whether there is an manipulation or not, we tested. Then the total duration of the test for completing the test, it was 150 for the first round, in the second 280, I guess, but in the first research, it takes 18 minutes for the test to complete the questionnaire, because the longer the time is, there will be more manipulations. or if they cheat from the others to make an assessment, and of course longer period means more cheating. It is 18 minutes, but by the way, this is average because it's open in skit, so it's an average. Or for example, the questions at certain domains. Again, to check for controversial answers, for suicide, attention and concentration, 4 questions. And looking at the response, again, you can check whether there's anything wrong. Whether the person is trying to cheat the test, again, right through the end, we directly ask the client whether you are actually honestly and correctly replying to the questions or not. So that's all from my side.